News Talk Sports for the Triad, WSJS. It's 5 minutes after 9 o'clock. Good morning, everybody. Happy Monday. Happy Triad today. Happy spooky season. That's right. 'Tis the season for the known and the unknown. Anyway, talking about unknown, John Dunn is here. And, John, welcome to Triad today. That'd be the first thing. We want to be polite. So
Thank
welcome.
you, Jeffrey. Glad to be with you.
Yeah, get over that now. Next time, you just come on in and have a seat and do what you got to do. But, John, we've started to see some advertisements, and, of course, there's been conversation in circles about, is this when we need to make some decisions about Medicare and our insurance and all that kinds of stuff? And that's the reason John is here. John, of course, with HealthTeam Advantage. Exactly what is, I never got a business card, so what is on your business card? What's it say?
Okay, so I am the Director of Sales for HealthTeam Advantage. HealthTeam Advantage is a local Medicare Advantage plan owned by Cone Health and Novant Health.
All right, so this is a collaborative effort to provide what needs to be provided.
That's correct, yes.
All right, so I've got some questions right off the bat, and I think if I don't know, then there may be some other people who go, I have wondered that, so I'm going to bite the bullet. I'm going to ask the questions.
Right.
So you can throw all this on me.
Jeffrey.
All right, we're going to go. What is Medicare Advantage? I hear it, but I go, oh, that's nice. I think that was a mama or grandma thing, but I don't know, so tell me what it is.
Okay, so Medicare Advantage is a system of health care for those who are eligible for Medicare's Part A and B. So to qualify to purchase or to enroll in a Medicare Advantage plan, you have to have both parts of Medicare A and B. It's kind of different than Medicare supplements. You probably have heard of those as well, or Medigap plans. Those work in collaboration with Medicare. So Medicare pays part of your bill. Your Medicare supplement pays what Medicare doesn't pay.
All right.
So Medicare Advantage is different in that all of your health care is provided by that health insurance company.
Kind of takes the place of.
It takes the place of. That's correct.
Right. All right. Now, here's another one. I hear Medicare Part A and Medicare Part B. And I know that my mama and my grandma used to both get letters about Part A and Part B. Yeah. Mostly my job was to stand there and smile and nod if anybody would ask. But there is a difference.
There is a difference.
And what is it?
So Medicare Part A is that part of Medicare that covers your in-hospital charges.
All right.
Part B is anything outpatient, your doctors, outpatient surgery. So you put the two together, and then
if I just don't feel good and I need to make an appointment and go,
with your
that's in the
primary
B.
doctor, that's going to be in B.
All right.
If you're admitted to the hospital, that's in A.
If I stumble over the dog and I go to the ER and I get admitted, that's Part A.
That's Part A.
See, I'm passing the test. All right. So we talked about if you add an Advantage plan, so you can either choose. I guess you could just, if that's your choice, you just remain with Medicare. It is what it is.
Yeah.
But if you have the Advantage plan, then, as you said, it takes the place, it steps in, but it's a fully comprehensive plan.
That's the great thing about a Medicare Advantage plan compared to original Medicare, which is A and B, or Medicare supplement. The Medicare Advantage plan is going to include all of those inpatient services. It's going to cover your outpatient services. Most plans are going to include your Part D drug coverage as well.
Okay.
And then you're also going to pick up a lot of times additional benefits such as dental, vision, fitness or gym memberships.
I didn't know any of that was even possible.
Absolutely.
With Medicare.
And that's what makes Medicare Advantage so appealing.
All right. Why? This is another big one. And so I've heard the conversation, and I've heard some folks talking about it at church, kind of get those whispers as you go down. Or if you're in a restaurant, you may hear, 4 senior citizens sitting at the next table. And I want to be helpful, but I don't know enough to be helpful yet. But I hear them talking about, and sometimes they just a lot of questions. Why am I hearing more of those conversations now than I heard, say, 2-3 months ago? Yeah.
So now, we are now in our annual enrollment period, or AEP.
Okay.
It technically started on Saturday, October the 1st, and runs through December the 7th. So the first 2 weeks of it, which is October the 1st through the 14th, you're able to go into Medicare.gov as a consumer and look at the different plan options that are available. And then when it turns October the 15th, that's when you're able to actually enroll in a new plan that would be effective January the 1st. So you have from October the 15th to December the 7th to choose a new plan if you're already on a plan. Or if you're not on a plan and, hey, these Medicare Advantage plans, they sound really good. Let me see what they're about.
All right, I'll ask the other question, which I'd imagine some people are asking. Well, why does John think he knows everything? So.
Well, I'll be the first to say John does not know everything.
All right, but
I've been doing this for 20 years. I've been doing Medicare Advantage for 18 years in a lot of different aspects of the business. You know, I am a licensed agent with the state of North Carolina. So I have sold the products. I have trained other agents in how to best represent and sell the products. And now in my current role at HealthTeam Advantage, that's what I do now. I train our employed sales agents.
Yeah.
I also work hand in hand with our brokers who are out in the field representing most of the plans that are available.
Do you think people get understandably nervous when it comes time to make a decision?
I think they do, because anybody who's been in Medicare for any length of time, they know this is the one time of the year that they have to make this decision for their health care for the whole next year.
So you're locked in now for 365 days. Is that right?
That is right.
Now, when these plans, when do they take effect? January 1st?
January the 1st.
Okay. Mm-hmm. And then you're locked in for 365 days. And then when the next season opens next year.
That's right.
Next October.
That's right.
Okay.
So, you know, a lot of people
choose wisely.
And, you know, a lot of people will try to sort through all of these plans themselves and look at Medicare.gov and look at this benefit or that benefit. But I really urge everyone to, hey, find a good agent, an agent that can sit down with you, dissect these plans with you. Because like we said, when you're choosing these plans for an entire year,
mm-hmm.
I get asked the question a lot. Well, what if I end up having to go to this hospital or this doctor, or my prescription drugs change?
Right.
You need to take a lot of that into consideration during this time when you're able to shop for a new plan.
And the sheer volume of information can be overwhelming for a great many people.
Absolutely. If you go to Medicare.gov and look at all the plans available just in the triad,
mm-hmm.
You know, we're over 50 plans to choose from.
Wow.
So it can definitely be overwhelming, overloading.
Yeah, you can. And particularly for a senior who maybe they've just had the same kind of coverage for so many years. Well, that's what I've always done. That's what my neighbor said to do.
Right.
And it might not necessarily be the very best decision for their circumstance.
That's right. Everybody's circumstance is individual to them.
Right.
And that's where an agent is so vital. They're able to look at your particular situation and weigh out all of the different benefits available from all of the plans and choose the one that's best for you.
We've already got a question. Bob, thanks for holding on through the break. What's your question for John this morning?
Okay. My wife and I have a Medicare supplement plan, and I mean, we do pay higher premiums than an Advantage plan, but we don't have any out-of-pocket expenses after the supplement part pays. But what John, to me, didn't explain too well was with the Advantage plan, you have so much more out-of-pocket expenses. I know the premiums are lower, but you have a lot more out-of-pocket expenses, and the dental coverage is limited. It's usually only about $1,000. So he didn't really explain that too well, I didn't think.
Well, I know Bob, I appreciate the question. We just touched the tip of the iceberg. So much to go over. So
that's right. You're right, Bob. It's a lot to consider comparing Medicare Advantage to Medicare Supplement. And as Jeffrey was saying, we have just started to scratch the surface. So, to address some of those questions and concerns, it sounds like you're probably on a Medicare Supplement Plan F that covers everything that A and B, the 20% that A and B does not cover. So that's why when you go to the doctor or you have a hospital stay, you have no additional cost out of pocket. You offset some of that not having those costs by paying a monthly premium. Those monthly premiums typically go up once a year, and that's just how Medicare Supplement works. But to address some of the issues you were talking about with Medicare Advantage and out-of-pocket cost is, yes, most Medicare Advantage plans in our area here in the Triad will have a $0 premium. So you don't pay a monthly premium to have that plan. But what you will pay are copays when you go to the doctor. Most of the plans will have a zero copay for your primary care provider. But when you go to the specialist, you would have a copay. If you needed an x-ray, you'd have a copay. And if you had to be admitted to the hospital, you would have a daily copay for the first 5 or 6 days of your stay. All of those plans do have a maximum out-of-pocket limit, meaning once you have paid X amount of dollars within a given year, then you have maxed out. You are capped out. You no longer have to pay your copays. And in our area, the Triad's a great area to be in for Medicare Advantage because a lot of those maximum out-of-pocket limits have come into under $4,000 now. Like ours at HealthTeam Advantage, we have one plan that has a $3,000 maximum out-of-pocket and another plan that has a $3,200 maximum out-of-pocket. So once your copays and coinsurances have met that limit, then you're done with your out-of-pocket costs for the year.
And John, it is. I'm not dismissing that limit, or 3,000 or 3,200 or 4,000. But if you're in for an extended hospital visit, that can literally be a drop in the bucket, and then everything else is covered?
That's right. So, when you're comparing that in Bob's situation to a Medicare supplement, look at what your monthly premiums are, multiply that by 12, how much is just that Medicare supplement costing you for the year. Now, on top of that, you have to add a premium for your Part D drug coverage because the Part D drug coverage is included in the Medicare Advantage plan. So how much are you paying per year now for that drug plan? If you're going to add dental or vision or even a gym membership, what are those items going to cost you for an entire year? So by the time you multiply all of that out, you may have more in cost per year just in premiums than what your out-of-pocket maximum may be on a Medicare Advantage plan.
Okay, so there's just a lot of different pieces of the puzzle to look at and find out if you're putting them all together, right?
That's right. And I'm not one of these people who are 100% for Medicare Advantage or 100% for Medicare Supplement. That's why I led off the show with saying, hey, everyone out there really needs an agent to sit down and talk to. There are situations, my dad being one, a Medicare Supplement works best for him just because of past health issues. My mom, Medicare Advantage works best for her. So that's why I say me and you were talking, Jeffrey, and it's purely a individual thing that everybody needs to look at for themselves. It's not a cookie cutter. It's not a one size fits all.
And that's good because it's seldom do you find that magic solution that works for just everybody, because everybody's got a different family dynamic, different financial circumstance,
right?
Which you got to take into account. And you were talking about, sometimes we piece it, so I got a little bit here and a little bit there, but you add all that together, then what is your yearly investment?
That's right.
And that can make a huge difference. All right, Brett, we still got Betty? All right, Betty's got a question about dental coverage. Betty, you're on with John Dunn on Triad today. Good morning.
Good morning, Betty.
Good morning, John, and good morning, Jeffrey. Thank you for taking my call. I live in Kernersville, and I saw the Kernersville News on Saturday, a really good-looking ad, and it mentioned a $3,750 dental allowance. I know your last caller said something about $1,000, so I just wonder if you could clarify that because I'm very interested in this.
Yes, Betty, and thanks for the call. And there, and this will help address some of Bob's issues as well with his questions on the dental. The ad you saw is for HealthTeam Advantage, and we are rolling out January the 1st our new dental benefit because we've heard from people like Bob is, hey, $1,000 a year doesn't get me what I need at the dentist. I'm still coming out having a lot of leftover charges that I'm having to pay out of pocket.
Okay.
So we heard that. We've been hearing it for the last few years. So we have upped our dental benefit to a total of $3,750 for the year. $750 of that is allotted for preventive services, which if you're going for 2 cleanings a year, that's plenty enough to cover
that'll
those.
Cover it.
And then you're left with $3,000 of comprehensive coverage to cover those crowns, those root canals, dentures, implants.
You're just a barrel of good news.
Hey, That's right.
But sometimes you wake up with a toothache and you got to go.
You have to go.
There's not a debate about
So Bob's
that.
issue is a relevant issue, and he's right. There have been limits throughout the years with the dental benefits on a lot of Medicare Advantage plans, and we are looking at how we could address that. And I think with the coming year, this new dental benefit, which Betty saw in the Greensboro paper or the Kernersville paper, addresses that and puts to ease at some of those.
You think that makes a big difference with HealthTeam Advantage and this being a local collaboration that you can respond more efficiently and quickly to the concerns that are raised?
Yes, and I hear that since I work closely with the brokers, I hear that on a daily basis. Hey, John, it's great to work with a company based right here in Greensboro. If we need something, we just pick up the phone. We get somebody local. We don't have to go through a phone tree or wait for a call back.
Yeah.
So the local aspect is phenomenal with HealthTeam Advantage.
All right, now I don't want to. We went through and hope we got Bob some information that will be useful. But then we talked a little bit. Sometimes you hear it, but it maybe doesn't register. You mentioned zero premium.
That's right. So most of the plans in the triad do have a zero premium. And the question I get every time when we say that, meeting with a customer for the first time, is, wait a minute.
I'm sitting here thinking it.
What's the catch, John?
Everybody gets paid,
right? So how can you do all of these benefits? How can you include vision and dental and a gym membership and my hospital and prescription drugs, all for zero premium?
Right. So explain that to me.
That's right. So like in Bob's case where he has a Medicare supplement, he pays a monthly premium for that Medicare supplement for the 20% that Medicare doesn't cover.
All right.
But then Medicare, throughout the years, has taken money from all of our paychecks to cover Medicare. When someone chooses to go on a Medicare Advantage plan, Medicare assigns those monthly premiums, basically, to the health plan, to the insurance company, to cover your health care cost.
All right. So you are paying.
So we are being paid
I got it.
by Medicare.
I got it. So I thought you just can't be in business
you can't
just giving
do it
away free. That's right. All right. Hey, we've got another question from Julie. Thanks for being on Try today and for holding on. Julie, you're up with John.
Great. Hey, John. Hey, Jeffrey. Good to talk to you. Can I ask two questions? Is that okay?
Sure. Go ahead.
Okay. One question is, if I do research and I decide, even from listening to John, and I decide, okay, yes, I want to be a member of HealthTeam Advantage, do I need to go through an agent, or can I call directly and talk to somebody about options within HTA?
You can call HTA directly, talk about options. We have our own employed licensed agents that talk about our product, can explain all the benefits, can look up your prescription drugs, look up your doctors, making sure they're in network. So I encourage everyone to speak with an agent, but you can enroll yourself. You can either do that through Medicare.gov, or you could go to our website, HealthTeamAdvantage.com or HTANC.com. Either one will take you to the same place, and you are able to enroll yourself right there on the website.
Could I speak with an expert
Absolutely.
at the company in the meantime to do that research?
Yes, they are on the phone 7 days a week, 8 a.m. to 8 p.m.
Very good. All right. Good answer. My second question is, I'm sure I'm not the only senior person who is overwhelmed with all these details, and so I've been paying attention to ads and all of them, and including HealthTeam Advantage, and I was intrigued by the benefit or claim you guys have that I'll have a concierge who works for me. So could you explain the benefits of that? Because I would love to call one person and have them, figure out my situation if something comes up.
Yeah, so that is one of the unique features of HealthTeam Advantage is we have our member services we call Healthcare Concierge. So when you enroll with HealthTeam Advantage, you are assigned a Healthcare Concierge. We call them HCCs for short. But you are assigned that person. You will get their business card, a magnetic business card with their picture. that you can put on their refrigerator with their number so that you'll have direct access to them. And as I said earlier, Julie, we do not have a phone tree at HealthTeam Advantage. When you dial that number, you get a live person. Now, if your healthcare concierge happens to be helping another member at the time, you will be given the choice to talk to another HCC, or you can wait for your assigned HCC to call you back. You'll have that option.
That sounds great, because I won't talk about other health insurance companies I've had, but you never talk to the same person again, and they're usually offshore, and there's a bad connection or a strong accent, and it's very frustrating. So the notion of a personal concierge just for me is incredibly great and special, it sounds like.
It is, absolutely. And you know, our tagline is local, reliable, accessible. Our HCCs are local people right here in the Triad. You go to the grocery store with them, church with them. They're people just like you and me.
I love that. And I liked what Betty called in about the dental thing. That's another huge plus, it sounds like, with HealthTeam Advantage. And it sounds like you guys really listen to what members say or the public says and address that.
We do surveys throughout the year with our members to see what they're looking for. We survey our agents and brokers to see what they're hearing from the community and what the needs are. And we take that to heart and try to implement that into our health plans each year.
And you know what? That's really special to be a local company that listens to local people.
For us, it makes all the difference, and it's what our company is based on.
Excellent. Well, thank you for your good answers, and I'll continue to listen. Thank you.
Thank you, Julie.
Thank you, Julie. I got to tag on to Julie's question there. Say everything's, I make my choice. I got my, HCC?
Your HCC.
And we're good. We're tight, and all that's all good. And then in February, something rolls around that I'm not sure about. Do I still have access to that HCC, or is it just during the enrollment period?
No, you have access all year long.
Cool.
Yes, they're there at your disposal to help you with your healthcare needs, scheduling appointments, seeing what doctors or specialists are closest to you to help in travel. So yeah, they're truly there to work hand in hand with you on your health.
Because your medical situation can certainly change at any given time, and you want to have somebody stable. That's you're not starting over.
I mean, you even get a bill that doesn't look right. Call that HCC up and say, hey, something's not right.
And do we ever really look at our medical bills?
Probably not, but we should.
I'm guilty of that. I looked for that one little box that says "You may owe," and that's the part I look at.
That's
John.
where all of our eyes automatically.
And you got to do better. You got to do better. All right. So another few questions. I get the feel, John. Again, this is all new for me too. That it's not the same year to year, and there are changes. So what's new for 2023?
That's right. So plans will change from year to year. We've had the last few years where we haven't seen that much change from one year to the next. But as I'm looking at all the plans available for the coming year, there are some significant changes coming along. And it's already been brought up, the dental benefit for a HealthTeam Advantage moving up to $3,750. That's a huge change. We've also lowered our maximum out-of-pocket limits, made them lower for people. Some of our co-pays we've also lowered. So it's vital to each year during this time to see what's available.
Okay, so I heard somebody ask the other day about the Inflation Reduction Act, and that's going to play a role. And I thought to myself, is it? I think y'all are confused. Was I confused, or were they right, or was it the other way around?
No, there are some medical issues built into the Inflation Reduction Act. The big one is
You're
insulin.
Kidding.
Oh, no.
They were absolutely on it then.
All
right. Okay.
Believe me, the senior population knows what's
paying
coming.
attention.
They
all right.
Pay attention to this. So yes, everyone will see if you're on an insulin. So the diabetics will see a decreased cost in what they're paying for insulin. So the Inflation Reduction Act says each health plan can charge no more than a $35 copay for a month's worth of insulin.
Okay.
So that's what all health plans here at the last minute are having to move to.
Yep.
To be sure those diabetics are taken care of, that we're meeting the letter of the law. So our PPO plans will do that as well. We also have a C-SNP plan where we provide insulins for zero copay.
depending on which plan you choose.
That's it. That's exactly right.
Because, I mean, for a lot of people, that's a major component of their health care plan.
It has been, yes. And that's one reason it was put into this Inflation Reduction Act, is to
try to address that and give some relief where it's needed most.
That's right.
Because if you don't have it, if you don't have access to it, you just face all kinds of medical issues then.
Oh, absolutely.
Life and death. I mean, not to be dramatic, it can become a life and death issue.
Life and death. I mean, if you can't afford the insulin and you need that daily, yes, it can play a drastic role in the decline of your health.
All right. I knew you were coming.
Mm-hmm.
So I did a little bit of research too, and I found another acronym, and I don't know what it means. ANOC?
ANOC, Annual Notice of Change. So,
my goodness, really? Come on,
you'll find
teach me about this one now. All right,
in Medicare than anything else I've ever seen.
Annual Notice of Change.
Annual Notice of Change. So anyone who is on a Medicare Advantage plan or a Part D drug plan will receive from their insurance carrier this letter, an annual notice of change, and it'll give you two columns, a 2022 column of what your current benefits are and a 2023 column of any changes in those benefits.
That's a smart thing.
Yes. So CMS requires we do that every year.
And pay attention when you get it.
Absolutely. And guess what? If you have any questions, what do?
Call my HCC.
That's right.
OEP versus SEP. This is more of I get dangerous when I'm left alone with a computer.
So we're into the different enrollment periods.
All right.
That's what the EP stands for in all
enrollment period. Got it.
Period. So right now we're in annual enrollment period, AEP.
Okay.
After this, we'll have open enrollment period, OEP.
Okay.
It runs from January the 1st to March 31st. And what that allows you to do is, hey, I found out my plan was changed. Either you initiated it or you didn't, and I want to change plans again, or you get your information pack, your welcome kit from the new plan you signed up for, and it's something in there that you just don't like. And I wish I'd kept my old plan. That is a chance that you get to go back. So you get
you get a second bite at the apple.
A one-time shot.
Okay.
To make a change, but that's only if you're in a Medicare Advantage plan to go to another Medicare Advantage plan.
All right.
You can't go from a MedSup to a MA or from just a standalone Part D plan to a Medicare Advantage. It's from a Medicare Advantage to a Medicare Advantage, one-time change.
And that runs for 3 months.
That runs for 3 months.
SEP.
SEP is a special enrollment period. That will cover anything. Okay, I moved to another part of the state.
Mm-hmm.
I need a different plan. Or I moved to another state completely. I need a new plan. You're able to use that SEP. For 2022, HealthTeam Advantage has been a 5-star plan. There is a 5-star SEP, special enrollment period.
Okay.
All year long, you can move from any plan to a 5-star plan.
All right.
So you get an enrollment period.
So are these Advantage plans, are they dictated in part by the region in which you live?
They are. And anytime you would do a search on your own at Medicare.gov, you would see you have to enter in a zip code.
And that's not just
what plans
that's not busy
available.
Work. That is applicable.
That is applicable. That's
all right. So where are the HealthTeam Advantage plans are relevant in what counties? Does it go? I'm assuming it goes county by county?
It does.
Okay.
So we're going to be in 11 counties.
All right.
For 2023. Those are going to see if I can rattle all of these off.
All right, go for it.
Good test question, though, Jeffrey.
I can help.
Guilford, Forsyth.
Forsyth and Guilford, those were my first two guesses.
Alamance.
All right.
Randolph.
Yes.
Rockingham. Davidson.
And the other
Davie.
Yeah.
And then we're adding 4 new counties for 2023. Those are the 7
Stokes.
we're in.
Where Stokes is right here. Okay.
Yadkin.
Yes.
Caswell. And Montgomery. Those are our 11 counties.
Oh, I have people in Montgomery, as they say.
Yeah.
Wow, that's down home. All right. These are my people. So 11 counties in the triad at HealthTeam Advantage then. You offer plans which would be relevant and applicable to residents of those 11 counties.
That's correct.
All right. So let's say one of the big things, I think, with any insurance plan, any age group, is how much do my prescriptions cost?
That's right. That is why, that's another reason I say, hey, everyone, please talk to an agent. Let that agent run your prescription drugs. We have tools. We can type
So
your drugs
I can tell you, like I'm on Lasix, and you can look.
We can tell you what your copay will be. We can tell you
if
you're gonna be predicted to go into that dreaded donut hole or coverage gap.
Oh yeah, that's what when you've not reached your
when you reach a certain dollar limit.
You've reached a dollar amount, but you still got time and product that you need.
That's right, and you go into what they call a donut hole coverage gap, which is much better now than what it's been in years past.
Okay.
The costs are way more controlled today than they were a couple years ago.
And I'm assuming my HCC, my concierge, can tell me if my doctor's in the network.
All of that. That's right. That's what they do.
So
they're at your disposal.
I love Harold. Harold's my doctor, and I want to know if Harold's in my plan.
That's right. Call that HCC up or call one of our agents up if you're not on the plan and ask them.
All right. So really, we talked about all of this. The phone number again, 336-920-3648. The website, HealthTeamAdvantage.com, HTANC.com. But the very best next step, John, is what?
Talk to an agent.
Talk to an agent.
Yeah. They're gonna compare your drug costs. They're gonna make sure all of your doctors are in hospital or in the network so that you're not having a break in coverage. And they have tools to do that at their fingertips where they just type in your drugs, type in your doctor's name, and it gives them a list. Yes, this is what the copay is, or yes, this doctor is in network, or no, they're not. And I need to say this before we run out of time for our agent friends who are out there, because they have a new guideline that they have to go by this year that's put on them by CMS, and that is all agents have to record all calls with prospects.
Okay.
So people who are looking for a new plan or just want to compare plans, agents are required this year to record those calls. So when they tell you, hey, I'm recording this call,
they're not sneaking.
They're not sneaking anything in. It's a new guideline that's been put on them.
All righty. John Dunn with HealthTeam Advantage. This is fabulous. Are you going to come back again?
Absolutely. Next month, we'll do it again, Jeffrey.
If you've got a question about HealthTeam Advantage, call John or a member of the team, 336-920-3648.